Find out what the vFit from Joylux can do for you. This revolutionary device in women's health self-care for home use is changing women's lives for the better. Check out this candid conversation to learn more and contact Essential Therapies to get your vFit today. We have a guest here. This is Dr. Cindy Hodgson from Essential Therapies. I'm a physical therapist and exercise physiologist. There she is again. With an owner of Essential Therapies, and I've been a women's health specialist for a little over 20 years, and I was just super excited when I came across this product, and we are just having this informal chat tonight. Hopefully we can keep Kristen on here. Kristen, are you there? Can you hear me?
Yep, I can. Can you hear me? Am I back?
Yeah. Great.
I kept getting kicked off there.
I know, who knows? Well, this is how technology is, right? So we were just saying before we went live, everyone, that we were having an informal conversation tonight, and I'm just so excited to be able to offer this and introduce to you. This is Kristen Kane. She is the U.S. Is it market manager for Joylux? How would you describe it?
So I'm the U.S. accounts manager. So I oversee all of our medical offices in the United States as well as Canada. So I work with a variety of different types of health practitioners, from physical therapists to OBGYNs, urogynecologists, even plastic surgeons and dermatologists that are now entering the arena of intimate wellness and sexual health, which is great. We're happy to see it become more readily available, these solutions in different types of practices. We work with midwives, naturopaths, and just a whole array of different types of healthcare providers who are helping women who are seeking solutions, be it to changes due to menopause, childbirth, natural aging process, a variety of different stages of our lives that we go through. So I do oversee and partner with all of the offices in the US and Canada.
Fantastic. So, and you've been with this company for a little while, but how long has this product been available? So give us a little background.
So I've been with the company, actually Friday marks 4 years, and I came on board when we launched in the US 4 years ago. We actually launched outside of the US first. We launched in Canada first, and then we got FDA approval and designation as a low-risk general wellness device, and officially launched 4 years ago in the US, and I've been on board since.
Okay, so it's called a low-risk general wellness device. That's the term that the FDA.
Yes.
Okay, yep. So that's good to understand. So I'm just going to give kind of a quick background, just for those who might be watching who don't know very much about women's health and physical therapy and pelvic floor treatment. So we're going to be doing a lot more information on our channel and through Essential Therapies about this. I haven't done much, even though I've been doing this work for around 20 years, just because I've never really had to advertise this part of what I do, because the word just kind of gets out, and then most people who know my schedule from around here know it's hard to get in to see me anyway. So if I started advertising a whole bunch, it's like, okay, how do we fit this in? But the truth is, this is really an area that's near and dear to my heart, because I had problems myself way before having children. And I think a lot of it was, a lot of people think of this realm as, oh, I don't need to worry about that type of treatment because I'm not in menopause, or I haven't had any surgeries, I didn't have a hysterectomy, I'm not leaking, or whatever the case may be. But really, in my career of seeing women, and for a while I really saw only women who were having women's health problems, I have seen all age groups. So from young adult women through the later years of life. And even, I think for me, my problem started from being someone who was really, I wouldn't call myself an athlete, but I did marathons and triathlons, and I was just like a heavy exerciser. I just loved fitness, and being an exercise physiologist, I just overdid it. So I even see women who are very young having these problems, and even well into their older years, who are really active. And so it's surprising to them. So we have people like that. And then we have people who've had all kinds of surgeries. I mean, there's just so many people. Do you see that as well? And I wanted to just have you speak to that a little bit. And so what I do as a PT is work. I mean, I specialize in John Barnes myofascial release approach. So we're treating the whole body with all types of patients, men, women, children, the whole thing. But the women's health aspect is different than traditional PT pelvic floor work in that it's hands-on treatment, just using a gloved hand, actually vaginally working the pelvic floor and releasing that tissue, the fascia, which extends all up into the abdomen, out into the hips, into the back. And so a lot of my patients who maybe come for back pain, hip pain, other types of pain, it actually ends up pointing us to the pelvic floor with a lot of problems that are there. So it's just amazing the scope that this can lead to. And I would love to have you kind of incorporate that a little bit as you tell us, and I will then leave the floor over to you. So
yep, absolutely. And to your point of younger women, they've not yet had kids, they're healthy, they're active, there shouldn't really be an issue. And I'm sorry, there's sirens going on outside. But we are seeing, these younger women, they haven't had kids yet. So the assumption is that everything should be working exactly as it should. We weren't exactly spot on with that. There are young women who are taking birth control or different types of medication, anti-anxiety meds, et cetera, and they're seeing some negative effects from that. Not necessarily, of course, the pelvic floor muscles, but vaginal dryness, loss of sensation and arousal, general discomfort. Younger women who've gone through cancer treatment, essentially they're being thrown into the symptoms of early menopause. So while this particular profile, this young woman who's not yet had kids, she really wasn't on our radar, we quickly realized that she is actually, she can definitely benefit from using the vFit Gold Plus device and seeking solutions. Our primary focus initially was postpartum and menopausal women in mind. And then the more we got to speaking to different physicians and their patients and what they were needing, we did learn that there's a much broader need than we had initially anticipated for these specific issues. And of course, you are focusing so much on pelvic floor muscles, and the vFit does as well because it's engaging the pelvic floor muscles, but it's also addressing tissue health, and that's vitally important. Different medications, hormones, natural aging, stress, all of these things, as you know, they impact our bodies in a very physical way. And we lose collagen production, elastin. Stress urinary incontinence is not just due to loss of muscle tone. There's also structural issues. Vaginal tissue changes as we age. And of course, hormones play a huge part in that. So even though we really devised and launched this device with a pretty specific group of women, we really over time have learned that women from many different age groups and health needs are benefiting from it, which is phenomenal.
Great. And I can absolutely see how that would be. So great to be able to be part of this. And I just wanted to say too, like you mentioned, the muscles. So the tissue that we are focusing on is the fascia. So when we talk about the collagen and all this stuff, fascia has, the collagenous portion of fascia is what is so tight. And so, that's what I thought was so unique about this, is that we're talking about not just muscles. And that's kind of what we do in our world, is focusing on fascia, because the muscles are dependent on the fascia.
Yes.
And the tissue. So great. So are we ready to screen share? What do you think?
Yeah, let's do it.
Okay. So.
And please, anyone who's on this call with us, if you have questions, please feel free to jump in and send the questions or ask. This is informal, and feel free to either via chat or jump into the conversation.
So does everybody give me a thumbs up? Do you see our screen share there? Okay, fantastic. All right.
And if we want to pop into the next screen there. So the inspiration for this device, our CEO, Colette, has a very strong background in aesthetics and devices. She actually owned a line of very successful med spas. And of course, working in a med spa, she had access to and used all of the latest technology, had a very strong background in devices, actually created another wonderful device that was for facial skincare. When she had her son, she went through the changes that you expect with childbirth, but there were some that she really didn't anticipate. And in talking to her girlfriends and her physician and doing her own research, she discovered there really weren't a lot of solutions out there for women. And she just said, nope, this is not okay. And she gathered together some absolutely brilliant minds. Some of the engineers that were involved in this helped create Sonicare and Clarisonic, and some really strong engineering backgrounds. And of course, OBGYNs were heavily involved in the creation of the device. So that cute little man there, Coleman, her son, was really the reason that this device came to be.
Cool.
So we have right now the vFit Gold Plus, and this device, and we'll go into it in the next slide. And this really truly is to enrich the lives of women. This is not just about intimacy or sex. This is about our actual overall vaginal health and wellness. And, having confidence in intercourse and confidence in your body, those are vitally important to our overall well-being. And one thing that we have found through all of our studies was, as women have aged and they're going through menopause or have gone through menopause and had their children, a big impact was a loss of confidence. And in our studies, which we'll talk about in the slides, that is huge. And there's a lot of anxiety and even some embarrassment attached to some of these changes that we go through. And we really want women to understand that there are solutions out there and that they can be talking about these changes and these issues they're having, and they should be talking about it. So we're really trying to incentivize women to have these conversations. We should be talking about it with each other. We should be having conversations like this. We oftentimes hear from women that they've been suffering for decades and they haven't even shared this with their primary caregiver. Their physician that they've had for a long, long time, they're not talking about these changes. So our goal is to really help women embrace these changes that we're going through. We're all going to go through this together, and that there are solutions out there for them. So Dr. De La Torre is an OBGYN based here in Seattle. She's been instrumental in this device coming to market, and she is absolutely phenomenal. She's also a physician that will advise us when we do have a medical-based question for a patient. And she actually did create our entire Her Intimate Care line of products. And she is one of many physicians that endorses this product. When you go to medical symposiums, Cindy, you'll see physicians on podium discussing it with their peers. But we're in over 400 medical offices in the US with over 1,000 healthcare providers recommending it to their patients.
And now we are too.
Yes. So if we hop into the screen after this, so this is the vFit Gold Plus, which I happen to have right here. And I'll go ahead and turn this on. This device, it definitely has a certain look to it. Cindy, when I'm speaking to patients about it, I will generally talk about the vibration modality first. There are 3 modalities that make this device as effective as it is. There's the thermal loading, which is the gentle heat, the LED lights, which is the photobiomodulation, and then the sonic vibration. And I like to talk about the vibration modality first, because it is easy to have a misconception about what this device is and what it's for. Yes, it does vibrate, and yes, it's being inserted into the vagina. No, it is not a standard typical adult device. It actually does not have the power that a device of that nature would have. The vibration is actually part of the treatment. And we will talk about all of the 3 modalities. I want to talk about the ease of this device first. This is non-invasive and non-hormonal. There's no downtime. It's non-surgical. It partners beautifully with physical therapy or any of the in-office treatments like OSHOT, Thermiva, et cetera. Being able to use something at home is always convenient, but certainly during these zany last 2 years, having a home use device has been a game changer. For many months there, we didn't even have the option to go into an office. Fast, absolutely. You use this 3 times a week for 6 to 8 weeks. And then after that, you go into maintenance, which is simply 1 or 2 times per week, and that will maintain your results. This indicates noticeable benefits in 6 weeks. We often hear from women, usually around the 3-week mark, that they're really noticing a difference. Every once in a while, I'll hear from someone that they notice a difference after 1 or 2 uses, which I think is great, but in all likelihood, it might be a little bit more of a placebo effect. But, that's okay because that's positive. They have confidence that they're doing something positive for themselves. But generally, it's about 3 weeks that most women will notice a noticeable difference. And the maximum session time is 12 minutes. So this isn't a big time commitment. It's 6 to 12 minutes, depending on where you are in the protocol, 3 times a week for 6 to 8 weeks, and then 1 to 2 times per week for maintenance after that. And in terms of the cost, this is truly a fraction of the cost of most in-office treatments. So oftentimes the in-office treatment cost it's prohibitive to a lot of women. It's not financially comfortable. So $395 versus several $1,000s, that is a much more comfortable pricing arena for a lot of women. We can pop to the next. And honestly, if anyone has questions, please pop in at any time. So there are 4 light modes or time sessions on the device, 6, 8, 10, or 12 minutes. There's the sonic vibration, and there are 10 options for the vibration. There's 5 different patterns. And then within each pattern, you can choose a lower or a higher amplitude. One is not more effective than the next. It's really personal preference. So I strongly encourage women, when you're using it, toggle through and experience each vibration pattern and see what you prefer. And some women will have one favorite, and that's one they always do, and some will mix it up. It's entirely up to you. It's your preference. The heat, the thermal loading is a very comfortable, gentle heat. The maximum temp is 42 degrees Celsius, and that's when you're at that 10 to 12 minute session time. So that is a very comfortable, very relaxing temperature. The device itself that is inserted, that is a medical grade silicone. There's no latex or BPA. It's very, very safe. USB rechargeable. There's no batteries to replace. So you just plug this in and it will charge. You just charge it after each session. It charges in just a few hours. And then it has the photobiomodulation, and that is the LED lights. And it's important with anything that you're doing with LED lights that it's in a wavelength that is actually going to impact the skin that you're treating. And this, if anyone happens to ever need to know, the wavelength is 662 nanometers, which is optimal to positively impact vaginal tissue. So here's one of our studies, and there is a very important study result that's not on this slide that we need to update. And that is 100% of the participants in the study reported feeling more connected to their partner. And that's huge. Improved wellness, 95%, increased confidence, which we had talked about, that can shift for women, that increased 89%, and increased sensation, 89%. The improved wellness, they're speaking to the overall general vaginal tissue health, and it's also speaking to increased natural lubrication. As we age and go through menopause, and certain medications can cause vaginal dryness, which leads to a lot of discomfort, not just during intimacy, but just in general, that can be very uncomfortable. And the vFit Gold Plus device definitely helps increase natural lubrication, which is fantastic to be able to do that non-hormonally and without taking medication. And then the Photonic Gel, this is amazing. And this is a very concentrated lubricant that was designed to be used in conjunction with the device. This is very concentrated. I always recommend start with a small amount. If you need to add more, do. The beauty of this is it's water-based and it has hyaluronic acid and aloe. So for women who are experiencing that vaginal dryness, it really hydrates and soothes the tissue. Has an amazing slip to it, so it makes insertion very easy. It's very easy to wash off with soap and warm water, or we have device cleansing wipes. But a big thing about this that is phenomenal is it increases the efficacy of the LED lights by 45%. So we absolutely love our Photonic Gel. And we hear from a lot of our offices too that they have women, they come back to replenish it, but they're going through it a little faster than the norm because a lot of women are using it actually for lubricant for intercourse. It's just a great lubricant. And this is completely non-toxic. There's no parabens, mineral oils, synthetic fragrance. It's all pH balanced for vaginal tissue. So it's phenomenal. So this, we're going to go into a little bit more of our Her Intimate Care line, which Cindy, I don't believe you offer that yet. It is a phenomenal line of products that are designed specifically for the intimate area, and these are all pH balanced. And a lot of the products that are out there that are specifically marketed towards use for the intimate area, oftentimes they are not pH balanced and they are loaded with detergents and chemicals. So Dr. De La Torre has created the line of Her Intimate Care products based on these numbers here. More than 50% of women do experience external intimate dryness of the tissue. It's not just internal. And a lot of women don't even know. They're kind of uncomfortable. They're a little itchy. They think it might be their clothing. They're not really sure where this discomfort is coming from. And a lot of it has to do with hormones and aging. And 65% have turned down intercourse because they were concerned about scent. And there are so many products, I'm sure you've all seen them out there, that are heavily fragranced, and they have a lot of masking agents, and they also have a lot of chemicals. So if we go to the next slide, this is our Her Intimate Care line, and these are absolutely beautiful products. These are all clean ingredients, non-toxic ingredients, no synthetic fragrances, mineral oils, or parabens. And if we pop to the next slide, I think it should go over each. Yep. So the cleanser is a really unique cleanser, liquid body wash. This is aloe-based, not water-based, which most liquid cleansers, they are water-based. So this is absolutely phenomenal. Although it's designed specifically for the intimate area, it is fabulous for anyone who has dry, itchy body skin to use as your everyday wash. Being aloe-based, it's very soothing. You still get a great thorough cleansing, but without any detergents. I will say there's a little bit of a learning curve with it because you don't get those big, fat, fluffy bubbles that we tend to associate with our body washes, because it doesn't have detergents. It goes on, it's just a very slick, wonderful, soothing texture. Then we came out with our Revitalizer Serum, which I think is just the hero product. And this, again, designed specifically for use on the intimate area, but it's really great anywhere you have dry skin. Like I use it on my cuticles and my neck every day. It's phenomenal. And then we launched our She Bar, which although it is a bar, it's actually not a soap. There is no soap in this. It's a triple French milled. So you actually do get a really nice lather from it, but without detergents and without soap. All of these products can be used anywhere on the body. And again, all are completely clean ingredients. And even though there's no synthetic fragrance, because it has essential oils, they have just a really nice, light, fresh scent, but without synthetic fragrance. And if we go to our next, these are just, some of the recommendations. And Cindy, I believe you have some reviews from your patients as well.
Yeah, well, these actually are not from my patients personally, because I haven't been so busy with other things. I have not even brought this out to talk about it very much, but I've been using it personally and I love it. That's why I've been so excited about getting this out there, because I absolutely noticed, especially the lubrication, sort of like just the daily routine, I mean, that was definitely different. And I think just the whole, like, keeping the pelvic floor soft and mobile and all of that is just super good. But I as I was looking for these through the reviews, I was like, oh, there's several different types of people here. So I threw up like 3 or 4 of them. I have. So did you want
absolutely.
To read,
and when we hear from patients who share their feedback and their results, it's always a collective just yay in our office, because this is why we're doing what we're doing. We hear from women who, they haven't been intimate with their partner for 5 to 10 years because intercourse was too painful for them. Women who can't run or laugh or sneeze without peeing a little. I mean, these are all things that happen, and it doesn't, even women who haven't had kids can experience stress urinary incontinence. It can be a natural part of aging. And with the vFit Gold Plus device, it's addressing all of these issues in such an easy and comfortable way, versus going the surgical route, for instance. The thermal loading, that gentle heat, that's encouraging blood flow to the tissue. And with that blood flow, it carries the protein and nutrients and oxygen. It's strengthening the tissue by building that collagen. You've got the photobiomodulation, the LED lights, which has a tremendously positive impact on tissue. I mean, physicians have been using LED lights in aesthetics and wound care for decades because it works so well. And then you have that sonic vibration that is just, it's engaging those pelvic floor muscles without you having to do, being thoughtful and mindful. For instance, when you do Kegels, you are literally reclined and relaxing, and your body is naturally reacting to that mechanical stress. So the whole process itself is not only is it not painful, but it's actually very relaxing.
Mm-hmm. Yes, I would agree. As far as these reviews, this was amazing. This was a mom of 7. I thought, wow,
Yeah.
Someone definitely has changed my anatomy. Yeah, that's for sure. So what I liked about this one was she says, I now have stage 2 bladder prolapse, and it's not painful, which is often the case. It's not painful, but causes, like she's saying, with the sneeze, laughter, cough, bound to have a leak, and cannot see a toilet without having a sudden urge to urinate immediately, or it will stream down my leg. And I have a lot of patients who have experienced that, similar things as that. The Joylux has tremendously improved my bladder control. I am beyond grateful. I know this is a lot of personal detail, but there is another woman just stuck with making a decision. I hope that my review helps. Okay, as far as tightening up the lady, I'm not sure. I've not seen much change. I have only used it 3 weeks now, but so there's someone who's seen relief in 3 weeks. This was just 3 days ago. I noticed. Excited to try. It was easy to pair with your phone. Oh yes, the whole app use and the fact that it's Bluetooth. I did want to mention that. That's why I threw this one in there. It does have the calendar reminders to keep you on track. It's a great great self-care, especially in the menopausal years. The gel is great. I completely agree with that. A little goes a long way. I feel like this device does a lot of the work to keep you healthy as long as you age. I highly recommend. Just a few weeks, I've noticed a difference. I'm in perimenopause and noticed sex feeling painful. This was why I brought this one up, because I see a lot of patients with this problem as well. And this product has helped that immediately. I feel like I'm getting strength and flexibility back. Thank you. That's pretty exciting. And then here's someone 51 and have been menopausal for at least 5 years on HRT. For 2 of those years, moisture is a major issue. I have been using the Joylux vFit for a couple of weeks now, and I've noticed a considerable change for the better. I'm excited to keep up the therapy to see how much change I experience. So just, from, a variety of different experiences there. And I'm just very excited to be able to promote this and see who it can help. And I know a lot of the patients that I see, as we age, our whole body gets tighter, and there's a reason for keeping the pelvic floor, especially for women, mobile and soft. And unfortunately, just with lifestyle change, the frequency of intercourse decreases for a multitude of reasons. And there's a reason why anatomically we need that.
Yes.
So, that's what I think is just really neat also about this device.
And going back to the app, thank you for bringing up the app. That is new to the device. We did not have that until this last year, and people have been asking for an app to have reminders. So really, prior to that, we would say, hey, put a reminder on your phone's calendar. Most of us, have our phones nearby all the time. So as we were developing the app for reminders, we thought, if we're going to do this, let's put some great content in there. So you can personalize it in terms of you go in and you talk about where are you in menopause, are you sexually active, etc. It will come up with pre-programmed treatment times, and you do get those gentle reminders if you've missed a session, because it is important to be compliant with your protocol so you can get the best results. There's wonderful health education in the app. We're working on a forum where women can actually connect with each other, and not necessarily to talk about the device, but hey, I have horrible night sweats. Who has their favorite cooling sheets that you love? It's just a great place for women to connect and support each other. The Bluetooth is it's called BLE, which is Bluetooth Low Energy. It's a slightly different Bluetooth technology than a lot of devices out there. The Bluetooth is in the very end of the device near the charging port. So not only is it not inserted into the body, it actually never even comes in contact with your body. And it just clicks on periodically when you connect the device to your app, so it can track your session. So safety, of course, is paramount to us. So we made sure that the Bluetooth technology is completely safe. But we are loving how many women are utilizing the app, reading the health education, getting those reminders. We're hearing from women that it's definitely helping them stay within their protocol so that they are achieving better outcomes and the best results with their device. We love our app, and it's evolving. We'll be adding more content as we go.
Right. And I will say I've never had a problem, not once, for it connecting. A lot of times if you have, speakers, a multitude of devices, like, oh, it's not connecting or whatever, I've never had that problem. It's always, every single time it right on works. So, and it's really nice to have that calendar there. It's good. And then I did want to mention, or maybe you want to bring it up, that as we are offering this product now, if they purchase from us, how they get the app.
Yep. So purchase from you, there's a QR code on the box. Under the little outer sleeve, there's a unique QR code. So they download the Joylux app and it will prompt them to scan that QR code. When you scan that QR code, it is unlocking added benefits, extra power. It's making it what we would call our vFit Gold Plus. It is normally $99 a year for someone to upgrade. When they purchase from you, that upgrade is included. So when they scan that QR code, it is unlocking 32% higher power, more energy. You're getting longer session times and you're getting more vibration patterns. And that comes with the device that you offer. So it really is a phenomenal incentive to purchase from you. And then plus they also have your professional guidance. You're there to assist them. You are their healthcare provider. You're not just buying something off a shelf. You actually have, the backup of your healthcare provider walking you through the protocol and the results. And that does come with the device when they purchase directly from you. So it's a very nice added savings.
Yeah, right. And I did also want to say we are going to offer that. You and I had talked about the carrying case. Comes with this great carry case that for travel, which I
love the travel case. We love the travel case. In the travel case, it will house the device, the Photonic Gel, the charging cord, and there's a little opening on the side. And this is strategic place. It is meant to be there. This is designed to you can run the charging cord through this. So if you are in a position where you need to discreetly charge your device, maybe you're traveling with a friend or you share your bathroom with your teenage son, maybe you don't want it out on the counter while it's charging, you can keep it in the handy little case, run that charging cord through and discreetly charge it. So we love our travel cases.
Yeah, that works great. And then I am going to get with you this week yet to order some of those other products that you mentioned. Super excited to try those.
The Her Intimate Care products, they really are phenomenal. They're beautiful. They're high quality. You feel like you're pampering yourself and really caring for yourself with these products. We love them.
And just, I'm all about, we use essential oils a lot in our practice, and just staying away from all of these other additives that are in all of these products everywhere. It's just, it's too much toxicity. So these are exciting to be able to offer as well. And just even to introduce this to other healthcare providers. So a lot of people may be watching this who are other PTs that I know, and just, get with me, let me introduce you to Kristen so that you can offer this to your patients and clients around the country, of people that I know as well. It's just really excited to get the word out for you.
Wonderful. Well, we appreciate that kind of support. And we have had so many of our practitioners who've come on board because they've heard of us through a colleague or a peer or from a patient. Hey, my sister purchased this device from her OBGYN. Can you get it for me? Because so many people share these same concerns and issues as we age. And we do love that women are starting to talk about this more. It is not taboo. This is something we need to be talking about. This is our well-being. It impacts so many different aspects of our lives. And we are getting better. Women are becoming more open and talking about it, but we're not quite where we need to be. This needs to be a very open, easy conversation. Being able to post on Facebook about product without it being taken down by, getting put in Facebook jail, or, this is not taboo. This is women's health. This is very important.
On so many levels too. And it's not, it's everywhere. It's all our entire body, because everything is connected, as everybody knows. That's my message, so hip pain, back pain, tailbone pain, which is then also related to headaches, and just the whole picture, the whole piece. So does anybody have any questions? We don't have a whole lot of people on here, but I wanted to open it up if there was anybody or any other thoughts you might have, Kristen. I just really appreciate you taking the time. I know today was your day. It just worked out to be able to do this, and I really appreciate your time.
Yeah, absolutely. And if anyone calls in or messages you with questions, Cindy, please, send them my way. If it's something that we don't yet have an answer on, we can absolutely get an answer. There are a variety of different medical conditions and concerns that women are going through. So we certainly want to make sure that this device would be appropriate for them. And we do have a variety of different physicians across the US that we consult if it's something that we don't already have data or information on. But this device, truly, I'm in my 50s. I'm a mom. I'm postmenopausal. I am the target audience for this device. And I can personally speak for myself, the benefits that when I started using it, I was perimenopausal. I am now very postmenopausal. And there were changes that I anticipated could happen, but when they actually did happen, I was a little surprised. This device has changed everything. It truly is amazing. So for your postpartum, your new moms, for women who are really, it's more of a preventative measure. They just want to maintain their existing health. And women who have gone through menopause or different stages in their life that they're experiencing discomfort and changes they're not pleased with, there are solutions. And we really hope that they're talking to you, Cindy, or their OBGYN, their healthcare provider, their friends to get ideas, because there are solutions out there. We deserve to have this care for ourselves.
I love when we were talking on the phone about all this, you mentioned you had a time period there where you kind of went off the device for a little while. You gotta
never again. Never again. For 3 months, I stopped using it. I have no valid reason. I have no reason at all that I stopped using it. And I'd been using it for over 3 years, stopped for 3 months. I cannot believe the changes that occurred in those 3 months. And while I am, in a way, I'm kicking myself that I stopped using it, it was actually probably good, because it gave me a very clear picture of the benefits I was receiving from using it. I know I will never stray again. Went back into the protocol, started at 6 minutes, 8 minutes, worked my way back up to 12 minutes. And I would say it was probably 5 sessions that I felt like things were right again. Things were as they should be. All was right in my world. I honestly have no excuse for why I stopped, but ultimately it was good, because I could really then get a better idea of the benefits I was truly receiving. I'd been using it so long, I guess I got, just kind of used to always feeling good. And yeah, no, I will never stop again. Even if you get busy, steal just one time a week. If you can steal 10 or 12 minutes, carve out for yourself, lock the kids out of the room, turn on your favorite music, whatever you need to do to have that time. It is really important. And I definitely learned a lesson there.
Great lesson. And we all talk about self-care a lot at Essential Therapies. And so, life happens. We get up, and I always think of it as a gift, because then you realize, oh yeah, that's why I do all that stuff,
When you hear about the moms, they lock themselves in the closet with a glass of red wine just to hide pets. And, sometimes you just have to do these things. We deserve this time for ourselves. We really do. And especially now, and, even though things are better than they were 2 years ago, people still aren't quite socializing and going out maybe as much as they were. We've got time at home. We can steal those 10 or 12 minutes a few times a week. We need to. It's important.
Absolutely, to keep up on it. Awesome. So if nobody has any questions, I guess we're done chatting for now, at least. Anybody else? Anybody real quick? I don't think so.
Well, if any come up, certainly please send them my way.
Well, thanks so much, Kristen. Thank you everyone for joining. And this will be out. I'll have it available for you guys to watch later as well, so you can spread the word. All right. Have a good night.
Thank you, Cindy. Everyone have a good evening.
Thank you.
Bye.
Thank you for joining us, and please share this video with other women who may benefit. Have a great day.